7:08 now, and our top story this morning. If you or your child have a physical problem, I don't know, so you break your arm or you need stitches, you'd expect to receive treatment, wouldn't you, from the health service locally? But what if you're under 18 and you have a mental health problem? Well, in Herefordshire, there are currently no beds to treat children needing inpatient help for mental health issues. One local mum of a 16-year-old who's been sectioned following a double suicide attempt says that there needs to be more support for young people like them. The teenager, who we've been asked not to name, is currently being treated in a private mental health hospital in Staffordshire. So that's a 4-hour round trip for their family to visit them. Now, their mum's been speaking to our reporter Julie Tyler about her recent experience of the Children and Adolescent Mental Health Service, or CAMS.
When all this started, we rang CAMS virtually on a daily basis to be fobbed off with useless platitudes, basically. And in the end, the only way we could actually help was to call an ambulance and the police. That was the only way we could do it.
And what help was offered then?
Taken into children's ward both times to stay there over the weekend with all the other very young patients, which was not suitable. They were frightened. I mean, basically, if you've got a teenager who's raging, with mental health issues through a children's ward where you've got sick children, it's just not appropriate. And then, finally, the psychologist actually agreed with me I need to go to hospital, because before he'd implied that I was neurotic and there was not really anything to worry about.
So what are your concerns that there's a gaping hole?
16 to 18, basically, the Stonebow unit in Hereford is not designed for children. There's no facilities. I think if there were more units, or if there were units attached to hospitals where they were set up for this kind of thing, it would be a lot better. I didn't have any choice. The first time in Birmingham, which was the closest unit, I believe, which wasn't too bad. Although it was a drive, it wasn't too bad. And then the second time, we were told it was either Staffordshire or Maidstone in Kent. Luckily, we got Staffordshire, but that's still 2 hours away, so we can't visit as often as we like. I just feel very sorry. Out of control situation that I can't do anything about. I mean, it was actually sectioned. It took 6 police officers to restrain throwing things around the house with 3 young children. So it was dangerous. The week previous to being sectioned, slashed wrists, went into hospital, absconded. Police held him up 2 hours and had to bring back and guard in A&E. When it was assessed, the psychologist said yes, needs to go into hospital, but there wasn't one bed in the entire country. So basically, drugged up and sent home. We were assessed in Birmingham on Monday. This was on the Thursday, given the highest dose of clonazepam, which is apparently the equivalent of Valium. It didn't work anyway, so it was the Saturday that we had to call the police and literally taken away. At the moment, we can't visit very often because it's a 4-hour round trip. We've got 3 young children, so a local facility would be a lot better.
So that's the mum of a 16-year-old from Herefordshire who's currently in Staffordshire Mental Health Hospital being treated there, demanding more local support for her child. Now, we did ask the clinical commissioning group, the CCG, responsible for looking after mental health in Herefordshire, to come on the programme. They've declined, but they have sent us a statement which says...
They say there are no mental health beds for children within the county and blame the national shortage of beds within the NHS. They say Herefordshire Child and Adolescent Mental Health Services provide community support for more than 2,000 children and young people each year. Worcestershire tell us that they helped 1,774 young people last year.
Let's talk to Andrea Maddocks, who's the Chief Executive of Mentor Link in Worcester. That's a children's mental health charity. Andrea's in the studio with us. Morning.
Good morning.
Thanks for coming in. It's a fairly distressing situation, this, isn't it, listening to that interview? How often do you come across this kind of thing in these traumatic cases?
Well, obviously, this is a one-off case, and Mental Link actually tries to provide some support to the children and the families before it gets to this stage. We are a local charity, but we don't have any bedded units available.
And obviously, this is a case in Herefordshire. It seems there's no mental health hospital there for juniors. They're shipped hours away sometimes. Is that the case in Worcestershire? Is it a similar case here?
I don't know personally on that sort of level, but Hereford, it just might be the county of Herefordshire faces problems like that. I'm not quite sure.
Is that acceptable? I mean, to be having to make a 4-hour round trip?
I always think that if the family feel well supported in themselves, they're able to best support their child. So it's about the adults coming together, working together for the best interests of the children.
But is it a case that mental health isn't being addressed in its initial stage in children, and nothing gets done until it actually reaches a crisis point?
Yes, I would certainly read that in this case. Mentor Link, we provide one-to-one support for sort of low-level mental health issues, with the idea that it doesn't escalate to these higher levels when it gets into crisis.
It's always difficult, isn't it? I mean, it's a very difficult time in everyone's life, isn't it, being a teenager? That sort of adolescent period is quite traumatic. We were chatting about this only the other day. There seem to be more and more pressures
Yes.
on children with, social media and all this
Yes.
kind of thing, and bullying and body image. I mean, are mental health issues among that age group? Are you seeing more problems?
We see we see between 400 and 450 children a year. What we've seen recently, there's certain trends in mental health issues with children. So recently we've seen a lot of self-harm amongst children.
Do you think that cuts in the NHS funding have made it more difficult for you?
I think there is certainly a higher level of referrals to our charity, and the level of support from the NHS is now at a higher level, so it has to get to a certain level before there are interventions.
OK. Thanks ever so much for coming in and talking to us this morning. That's Andrea Maddocks, who is the Chief Executive of Mentor Link in Worcester. We'll be looking at this throughout the programme this morning. Love your thoughts as always. If you have any experience, do get in touch, please. If you've got a similar story, we'd love to hear yours. It's 7:15 now.